Hello, everyone. Welcome back. My name is Evyn, broker Pollard. I am a licensed life health accident and sickness broker in North Carolina as well as Arizona currently. Now, I have been licensed in quite a few other states before. I will gain those licenses once again for you guys. And later on in the future, when I do become licensed in your state, then we can definitely work together. But I am here to talk about Medicare 101 today. Let's talk about your health. More specifically, the insurance that you're required to have by law. Now, what do I mean by that? We'll get into it in this video. But at any point in this video, if you do find it helpful and useful, please go ahead, give it a like, comment any questions that you have or a discussion that you want to start, and also share, share, share. Now, with that being said, let's go ahead and get into it today. Okay, everyone, I am back. Thank you, thank you. So, today, again, I do have this presentation that I have put together for you all that I am so excited to share with you. So, without further ado, let's go ahead and get into it. Now, on this main page, what we're going to do is cover the basics. Now, I'm going to hide myself here for a moment just so that we can see the objectives, but really, I want to highlight what we will be covering today. I will be covering the main things that you need to know when it comes to Medicare. Firstly, who is eligible and how do you become eligible? Once you are eligible for Medicare, what coverages does it provide and what are your options for coverage? Once we know what options you have, then we will discuss when you can enroll. There are other important factors that you need to know because the laws are constantly changing, and I've provided new information for 2025, including the Inflation Reduction Act, and I will also review the star rating and how each plan is measured. And lastly, you'll get to know how to contact me regarding my services. Now, who is eligible for Medicare? There are a couple of ways that you may become eligible for Medicare. First and foremost, many people become eligible by turning 65 years of age. As many of you have experienced, if you are around that age, you receive an insurmountable amount of mail, phone calls, emails, whatever it may be, infomercials. And all of that information is there welcoming you to the party. Now, secondly, if you are under 65, you do qualify for Medicare if you have been receiving Social Security disability insurance for 24 months. And once you hit that 25th month, you do become eligible for Medicare. There is an outlier as far as becoming eligible, which will be if you are an ESRD, in stage renal disease, or suffer from Lou Gehrig's disease, which is also known as ASL. Once you are diagnosed with either of those, you will automatically qualify for Medicare. Now, of course, you have to be a citizen or a permanent resident for at least 5 consecutive years in the United States. Let's talk a little bit more about turning 65 and whether or not you should choose to opt in for Social Security benefits. Now, you don't have to collect Social Security benefits at this time, but if you do, here is what happens. If you have Social Security by the time you turn 65, you will be enrolled into Medicare automatically, into Part A and Part B. You will receive your Medicare card 3 months prior to your 65th birthday. This opens you up for a special enrollment period that we'll talk a little bit more about that later. Now, if you do live in the US territory like Puerto Rico, you are eligible for automatic enrollment into Medicare Part A. However, you must actively enroll into Part B to receive the coverage if you are in a U.S. territory like Puerto Rico. On the other hand, if you do not have Social Security when you turn 65, there are three ways that you can enroll, as noted here on the screen. You can go online, you can call, or apply in person at your local Social Security office. Now, what is covered under Medicare? If you take a look at your Medicare card, you will have Part A and B effective dates on that. It's usually going to be the month and the year that you turn 65, but for all others who qualify for Medicare before then, it will be the date that you become eligible. Part A, as you see, is going to cover your hospital, and then Part B is going to cover your outpatient medical insurance. Now, time for Part A. Let's talk a little bit more about what Part A covers for you. Now, as previously mentioned, it is going to be your inpatient hospital care insurance. It'll include coverage for things like your skilled nursing facilities, hospice care, limited home health care, and other services. But this is, again, not a complete list of the services that you will receive. Here's a breakdown of Part A eligibility and what you may pay. If you or your spouse has worked 40 quarters or more, you have already paid into your Part A and there's no cost there for you. If you have worked at least 30 quarters, you will receive a reduced cost to $278 per month. And in the rare case you've worked less than 30 quarters, you will be subject to the full cost of Part A at $505 per month. Part B. Moving on to Part B of Medicare. Now, again, this is going to be coverage for your outpatient services. This is going to include coverage like your doctors and specialist visit, your preventative care services, outpatient surgery, diagnostic tests and screenings, as well as your emergency care and durable medical equipment. And again, this is not a complete list of the services provided under your Part B benefits. The cost for Part B is based on your household income. I'm showing you the 2024 numbers for the cost of the Part B Medicare in your home as it is based on your income. That base premium that you're going to see coming out of your Social Security check every month in 2024 is $174.70. This is a recurring charge that you're going to pay throughout your lifetime on Medicare. This number is subject to how much you make, and if you earn more than a certain threshold, you will be subject to a higher premium. Here is the chart for your income related monthly adjustment amount. The income on your 2023 IRS tax return that you filed in 2024 determines the amount you will pay in 2025. They are basing this off of your income from 2 years prior. This is a surcharge on Part B premiums for higher income enrollees. So go ahead and pause the video at this time, see where you land. So there is one thing that comes with not enrolling, and this is where you don't want to end up. We do have a late enrollment penalty for Part B. It is a lifetime. So please, 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 please do your due diligence and make sure that you have creditable coverage so that you do not become subject to this. So moving on. Every year that you go without Part B creditable coverage, you will be subject to that penalty. Now, there's a few ways to avoid this penalty. So, some people may be covered through a group health plan through their employer. And for those who have COBRA, you may qualify for a special enrollment period. I have heard some stories about this, and if you do believe that you had creditable coverage during this time, let's say a job-based insurance plan, you can appeal the penalty following the directions that you receive from the letter informing you of the penalty. If it has been quite some time, I have spoken to a spouse who had creditable coverage through her husband's employer, but he had then since passed and the employer has then dissolved. So there was no way for her to gather this information from years prior to present that coverage information. So even though she had that creditable coverage, she did not have a way to prove it. It is very, very important that you keep record of that if you do choose to keep your employer insurance at that time when you are eligible for Part B, or just simply enroll in Part B and start taking those deductions. Getting into Part B changes in 2025. We'll get into more details about the Inflation Reduction Act of 2025 in just a little bit, but I wanted to touch on some Part B changes while we're on the topic. There have been changes made to Medicare to make it more accessible and equitable and affordable by the means of receiving services. So, changes do include improved access to high quality, affordable biosimilars, as well as imposing a $35 per month cost sharing cap on insulin used in durable medical equipment pumps. This lowers what Medicare spends on prescription drugs and limits increases in prices. Now, there are a few things that are not covered in original Medicare. Just to quickly explain this, when it comes to original Medicare, Part A and Part B, these insurance coverages only cover 80% of the cost, which leaves you responsible for the other 20% of the cost. That will include any premiums, deductibles, co-payments, and co-insurance. Now, there are a few exclusions under original Medicare. You're not going to be able to get coverage for your prescription drugs, hearing aids, exams, nor screenings, your routine eye exams or glasses, and you will also not get coverage outside of the US. So if you're a traveler, you need something more than just original Medicare. What are your Medicare options? With Medicare, we have Part A, B, C, and D. So we just went over Parts A and B. Now I'll introduce to you Part C and D. Part C is going to be Medicare Advantage, and Part D is going to cover your prescription drugs. Part C. Part C is Medicare Advantage. This is an alternative to original Medicare. These plans are provided by private insurance companies that are approved by Medicare. Part C plans may lower your out of pocket costs. However, you'll usually need to use the doctors that are in their network. Some plans may offer non emergency coverage outside of their network, but it'll typically be more expensive to do so. Medicare Advantage plans offer coverage for Part A, B, and D under one policy. Medicare Advantage plans cover all of the inpatient and outpatient services that Medicare Part A and B cover, except for clinical trials and hospice services. Part D. Part D covers your prescription drugs. There aren't a lot of requirements in order to enroll in a plan like this. Number one, you must live in the plan service area. And two, you have to be enrolled in either Part A or Part B of Medicare. It does not have to be both. There are two ways that you can enroll into a Part D prescription drug plan. Number one, you may choose to enroll in a standalone plan, and that is ideal for people who are in original Medicare and don't have prescription drug coverage. Or you may also choose to enroll in a Medicare Advantage plan that includes the prescription drug coverage with it. Not all Medicare Advantage plans include prescription drug coverage, which is good for the people who are veterans and may have TRICARE or VA benefits. Now, I know we just saw this chart earlier, but wait, there's more. But no, 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 no. We have not. Now we're looking at the Part D costs associated with your income level. You are required to pay your plan premium in addition to this surcharge. Please, again, go ahead and pause the video so that you can see where you land. Moving on, depending on your income, you may qualify for extra help. That is also known as the LIS or low income subsidy. You may hear all three of those things, and it's all referring to the same thing. This is a program that assists those with limited resources in paying for their Medicare prescription drug costs. Extra Help also had an expansion this year in 2024. Extra Help's expansion will cover more people with limited resources who earn up to 150% of the federal poverty level. You may automatically qualify for Extra Help if you have Medicare and are enrolled in any of the following programs. If you receive full Medicaid coverage assistance from your state Medicaid program for covering Part B premiums, or if you receive Social Security income benefits. So even if you don't qualify for LIS automatically, you can still apply at any time. There are a few ways that you can apply for extra help, which you can do that by going online, by phone, an application, or you can schedule an appointment at your local Social Security office. Just as we saw the late enrollment penalty for Part B in Medicare, there's also a late enrollment penalty for Part D as well. And this is going to be calculated by multiplying the national base beneficiary premium by the number of months that you went without creditable coverage. And that penalty is added to your monthly Part D premium and rounded up to the nearest 10 cents. You really, again, don't want to miss out on having that coverage or proof of coverage if you're choosing not to go with it. Again, just like Part B's late enrollment penalty, that one is each year. Part D for your prescription drugs is going to be calculated per month that you don't have that creditable coverage. If the national beneficiary premium increases each year, your penalty will also increase with it. Don't miss it. If you do receive a letter notifying you of any penalties that you owe, you have 60 days from the date of receipt on the letter to file an appeal. So there are a few ways that you can avoid this penalty. Number one, have the creditable coverage. Secondly, if you do qualify for low income subsidy or LIS, extra help, then that can also help pay for these penalties as well. And then lastly, if you did have that creditable coverage, you want to keep that information on file for yourself and appeal if you do receive notification that you did get this penalty. Here's something new. We have different coverage stages in Part D. Many of us are pretty accustomed to the four stages that have been in effect up until 2024. In 2025, the coverage gap, better known as the donut hole, will be eliminated. Now we have three stages: the deductible, initial coverage, and catastrophic phases. The deductible phase is the amount that you will pay on an annual basis, in which you are 100% responsible for the cost of your prescription drugs up to a certain amount. It is important to note here that some plans have a $0 deductible. Once your deductible is satisfied, you will enter in the initial coverage phase. The plan pays its portion of covered prescription drugs while you are responsible for your share in the form of a co-payment or co-insurance amount. Any money spent on prescriptions during the deductible and initial coverage stages count towards the member's true out-of-pocket costs. Finally, when you reach the catastrophic stage, you will pay $0 for covered drugs. For plan year 2025, the Inflation Reduction Act made a significant number of changes in the Part D benefit that is aimed at reducing the members' out of pocket costs. In the deductible phase, we did get a change there. In 2024, the maximum deductible allowed increased from $545 to $590. Not too significant of a jump, but it is something. However, most notably, the initial coverage stage limit in 2024 used to be $5,030, which is now reduced down to just $2,000. This drastically limits your out of pocket costs because you're no longer responsible for paying drugs beyond this point until it resets the next year, of course. Part of this new redesign means that plans and drug manufacturers now have to pay a larger share of the cost in the catastrophic phase, and Medicare will now pay a smaller share. Now, can I take a candid moment here? Because I completed this before all of the new season rollout. Gaining more perspective on this slide is carriers and drug manufacturers now have to foot the bill for these drug costs. Even though you, as the member, don't have to pay into your prescription drugs that much anymore, we'll just say it is impacting a lot of other places of these plans that are available to you. It is extremely important to make sure that you look at the coverage that you currently have, calculate your current costs, because when it comes to the plans, you will see a shift in what is being offered on the market. Moving on. Okay. I want to be excited about it. I do. This is one thing that I may find helpful coming out of this 2025 Inflation Reduction Act. For the first time ever, the prescription drug law, known as the Inflation Reduction Act, will now require Medicare prescription drug plans to offer enrollees the option to pay out of pocket drug costs in the form of capped monthly payment instead of paying when you get to the pharmacy. This is going to be called the prescription payment plan that is launching January 1st, 2025. You, the enrollee, can receive a monthly bill that breaks down the expenses into a manageable payment. This is particularly helpful to people with high prescription costs. Now, there are some stipulations that come with the prescription payment plan. You can opt in at any time of the year, but I want to note that if you do get behind on these payments, you will be dropped from it and you cannot get back on it until you pay that debt. Again, it's really important for people who do need to get their prescription drugs at the pharmacy. They either have a lot of them or high cost drugs, and having their estimated payments for the year being broken down into monthly payments can help that person still receive their medications and then also pay for them in a more manageable way. But again, if you do choose to opt into this, you don't want to miss those payments just in case this is something that may be helpful for you. It's an option. Part D improvements have been made. The overall goal is to allow people on Medicare to benefit from lower prescription drug costs with a redesigned program. Insulin is available at just $35 per month per covered prescription. Adult vaccines can be accessed with no cost sharing. And as previously mentioned, LIS has now been expanded to cover more people up to 150% of the federal poverty level. With all of this talk of inflation going on, the new law requires drug companies that raise their drug rates faster than the rate of inflation to pay Medicare a rebate. Medicare will be able to negotiate directly with these manufacturers to lower the cost of price of some of the most costliest name brand drugs for Part B and D. Medicare Supplement Plan, also known as Medigap. So, we just covered quite a bit. Another major coverage option available to you is in the form of a Medicare supplement plan. These plans can fill in the gaps that original Medicare does not cover. That is also why they're called Medigap policies. These supplement policies are also sold by private insurance companies that are approved by Medicare. They can help pay for some of the remaining healthcare costs and services and supplies. In order to be eligible for a plan like this, many of them do require you to be 65 or older to enroll into them. You also have to have Medicare Parts A and B, and then you have to live in the state where the policy you want is offered. It is very important to note that these plans only cover one person. And when you acquire a Medicare supplement plan, you are required to pay the plan premium in addition to the Part B premium. A great feature about this policy is that it is guaranteed to renew each and every year as long as you pay for the plan. So it just means that your insurance company cannot cancel your plan as long as you pay the premium and as long as you provide accurate information at the time of your application. There are some things that a Medigap policy does not cover. Some of those items can include things like long-term care, vision, dental, caring, your private duty nursing, and also prescription drugs. In order to get some of these extra benefits, you are going to have to acquire another policy. Because Medicare supplement plans don't include prescription drug coverage, you are going to have to enroll into a standalone prescription drug plan in order to receive and keep creditable coverage so that you're not subject to that late enrollment penalty that we spoke about earlier. When to enroll into Medicare. So, these next two slides will cover your initial enrollment period. There are a few things that you can do during this time. For many people, Medicare's initial enrollment period is your first chance to enroll into original Medicare Parts A and B. If you're under 65 and receive Social Security or Railroad Retirement Board benefits, you may automatically be enrolled into original Medicare. During that time, you'll be able to make your Medicare coverage decisions. When you become eligible for Original Medicare, you also become eligible for Medicare Advantage Part C plans. Your enrollment into a Medicare Advantage plan will be considered your initial election coverage period. ICEP. Your initial election period begins the first 3 months before your birthday, the month of, and then 3 months after your 65th birthday. In addition to having the ability to pick an Advantage plan, you may also apply for Medicare Supplement plan at this time. You can enroll into a Medicare Supplement plan without a health assessment and still obtain guaranteed issue right. And it is undoubtedly the most opportune time to get into a Medicare Supplement plan. But again, if you're not 65, you may not be able to get into a Medicare Supplement plan anyway. But when you do turn 65, call me. The annual enrollment is the time of the year that many of us know best. And for Medicare, that is from October 15th to December 7th. Go ahead, look around, do your shopping, know exactly what you want to do and what you want to get. And as soon as the 15th hits, you are able to enroll. During this 6 week period, you do have the ability to switch from Original Medicare to a Medicare Advantage plan or vice versa. And you may also switch between the different kind of Advantage plans, whether that is with or without drug coverage. Lastly, you may either join, change, or disenroll from a standalone prescription drug plan at this time as well. Your election goes into effect on January 1st the following year. If you do change your mind during the enrollment season, no worries because you can complete as many applications as necessary during these 6 weeks. And the last enrollment that you complete is the one that Medicare will accept as the one that you intend to roll into. If you are already enrolled into a Medicare Advantage plan, there is another enrollment opportunity which is going to be available to you January 1st to March 31st. This is going to be an enrollment period made for Medicare Advantage and prescription drug coverages where you can make a one-time change. The changes that you made will go into effect on the first day of the following month after the enrollment request is received. There's also a general enrollment period that occurs at this time. If you missed your chance to apply for Original Medicare during your initial enrollment period or you weren't automatically enrolled, this is your chance to sign up for Part A and B. However, be aware that you may have a late enrollment penalty just depending on how long you chose to wait and whether or not you had that creditable coverage. A special enrollment period is your chance to make changes to your Medicare coverage outside of the open or annual enrollment period. When can you qualify for a special enrollment period, you may ask? No one asks. Some common qualifiers may include moving out of the service area, a change in your eligibility status that may include those who qualify for Medicaid, who either do now qualify or lose their qualification, if you have a chronic condition or lose that chronic condition. Those are some of those eligibilities that may change. Another thing that may qualify you is if you lose your existing coverage, if your Medicare plan has changed, and as well as the ability to get other healthcare coverage, which I will also note in the next upcoming slides here. You can contact me at any time to learn whether or not you do qualify for a special enrollment period, and I'll be happy to help. The length of your special enrollment period can vary depending on the type of qualifying event that it is. Now, generally, your special enrollment period can last 2 to 3 months. And for special circumstances like weather related, it can last as long as that weather incident is in place. If you lose your employer health coverage, you do have an 8 month window to enroll in parts A and B. And on the previous slide, I know I mentioned some eligibility changes as such as the Medicare, Medicaid that can qualify you for a special enrollment period along with chronic conditions, but there is also an institutionalized special enrollment period that is available as well to get into a plan that is suitable to those needs. What are star ratings? CMS, which is the Center for Medicare and Medicaid Services, uses a star rating system to evaluate the quality and performance of the Part C and D plans. And these plans are rated on a scale of 1 to 5, and obviously 5 being the highest. The ratings are based on how well a plan performs in several categories. That includes the quality of care and customer service. These plans are rated on an annual basis, and new ratings are released each year in the fall. And just as we finished up with the special enrollment period slides, 5-star rating plans also open you up for another special enrollment period where you can make a one time change in the year to a 5-star rated plan if you are not already in one. So that is a great opportunity to make that change. Between December 8th through November 30th, the enrollments in December are effective on January 1st. Enrollments from January to November are effective the following month from the enrollment. This star rating helps Medicare consumers compare the quality of health and drug plans being offered to them in their area, and this allows beneficiaries and caregivers to receive meaningful information about the quality of benefits, services, and costs. My services to you. Finally, who am I? What do I do? How can I help? What am I here for? I am a licensed health insurance broker who is your advocate for finding the most suitable plan based on your personal needs. I'm contracted with multiple insurance companies who pay me for providing my no cost services to you. Now, working with me relieves you from the stress, time, and money from doing the legwork on your own. You won't have to call each individual company just to provide them your medications, doctors, hospitals, and explain to them your top priorities and speak to 3 to 5 different call center agents. Stop wasting your time on captive agents that work for the corporation. I am here to work for you. And lastly, to finish this up, I am here to assist you through every step of the way, providing my no cost services prior to, during, and post enrollment as your designated broker. So you can give me a call today at the phone number listed on the screen, 720-303-5537. And you can scan this QR code to get started online at the Plan Enroll website, where you can then put in all of your information. If you decide to, you can get synced with me by putting in all of your information ahead of time so that we have things to discuss, or simply you call me. I'll make sure that I put that information in for you. You do have the option to go to that website, learn a little more information aside from what we covered here today, put in your doctors, your prescriptions, your hospitals, and put in any other information that you believe that I would find necessary to help you enroll, and we will get you covered today. I will also have the link in the description for you below. And the link is also on my main homepage on YouTube, where you can click that plan enroll link to get started. You do have the ability to self enroll if you would like. Starting on October 15th, you can go in, get that done. If you have any questions along the way, please feel free to ask me. And other than that, let's make this a seamless annual enrollment period. Please stay tuned for any online and in person events, as well as the other educational videos that I will be posting to this channel. Thank you for tuning in to Medicare 101 with me, Broker Pollard, and I look forward to hearing from you soon.